Good afternoon. I am Sarah Dash, President and CEO of the Alliance for Health Policy. Welcome to today's webinar on COVID-19. For those who are not familiar with the Alliance, welcome. We are a nonpartisan resource for the health policy community dedicated to advancing knowledge and understanding of health policy issues. The Alliance gratefully acknowledges the National Institute for Healthcare Management Foundation and the Commonwealth Fund for supporting today's webinar. You can join today's conversation on Twitter using the hashtag AllHealthLive and follow us at AllHealthPolicy. We want you all to be active participants, so please get your questions ready. And now I'm going to give you some quick technical notes for how you can ask them. You should see a dashboard on the right side of your web browser. Please select the speech bubble icon with the question mark to chat with us about any technical issues you might be experiencing. And you can use the second speech bubble icon to submit questions that you might have for the panelists at any time. We will collect these and address them during the broadcast. You will also find all of the materials that accompany this webinar on our website, as well as a recording of today's webinar. It has become painfully clear that we have severe shortages of medical supplies, particularly the personal protective equipment that is critical to keeping health workers safe as they treat patients with COVID-19. Today, I am so pleased to be joined by Mike Alkire. Mike is the president of Premier Inc., the largest global healthcare supply chain in the U.S. In 2018, Modern Healthcare named him one of the top 25 COOs in healthcare, and you can read his full bio on our website. I can think of no one better equipped to shed light on the state of the healthcare supply chain as we respond to the COVID-19 outbreak. Mike, welcome.
Thank you, Sarah, for having me.
Great. So, Mike, the shortages of medical supplies has really reached a fever pitch. Can you tell us a little bit about what the situation is on the ground right now, and what's your day-to-day look like as far as trying to remedy it?
Yeah, thank you, Sarah. So, just very, very quickly, let me give your listeners just a quick overview of who Premier is, and then I'll jump right into what's happening on it from a day-to-day perspective and what the products are that are in short supply. So Premier is, as Sarah described, a global supply chain company. We have a number of functions that we provide for about 4,000 hospitals in the U.S. and about 170,000 non-acute settings. First function is we help our healthcare systems negotiate contracts to get great pricing for products that they utilize to care for their patients. Second, we have a significant part of our organization that actually contract manufactures product all across the globe, and this includes producing exam gloves in Malaysia to personal protective attire in Cambodia to producing face masks in China and in Taiwan. So we have a very, very significant capability to support our healthcare systems as they are trying to provide care for their patients by leveraging our supply chain capability. We also have a clinical decision support capability, which is also being utilized at this point in time. We've got some technologies that can flip on alerting mechanisms in the real time to help healthcare systems and other clinicians identify when a COVID patient is entering into their work stream. We also have capabilities to set up best practice sharing around capabilities to help clinicians as they're sort of thinking through what are the right kind of treatments and those kinds of things. We have a technology infrastructure that allows for that kind of knowledge and best practice sharing. So just, Sarah, to answer your question very specifically, obviously for the last few weeks, our lives have been pretty crazy. And I will tell you how this sort of problem started to present itself is no different than the way that I think many of your listeners have seen what's happened in their everyday lives. So like if they go to their, neighborhood Costco, or they're going to their, neighborhood retailer, they go to find products, and what oftentimes they have found is those products are no longer on the shelves. And what's occurred is very naturally, the issue associated with, I would collectively call it human behavior, So when the press starts to highlight the issues associated with this virus, COVID-19, people rightfully are concerned, and they go out and they buy more product than they normally buy, and we have these very narrow supply chains. And what happens is when all that aberrant buying happens, it puts this incredible pressure on the supply chain, and it creates shortages. So because people have gone out and bought outside of their normal purchasing. I think the same thing actually happens within the healthcare setting, and I'll give you some very, very specific numbers. N95s, which is a face mask that you hear talked about in the press, which is a very important piece of personal protective attire. In the steady state, on an annual basis, our healthcare systems buy about somewhere between 22 and 24 million masks a year. In January and February, before this virus even became significantly prevalent in the U.S., our consumption of those N95s went to 56 million. So that was almost a threefold increase in the number of N95s. And now we think right now there's this ordering for probably somewhere between 110 and 150 million masks. And that's based on a supply chain that's built to create 22 to 24 million. So you can imagine, the significant steps that organizations like us and distributors and manufacturers are going through to sort of meet that supply challenge. And then ventilators is another area that is an area where we've got pretty significant shortages. In any one year, and we represent probably about 40% of all U.S. healthcare systems. In any one year, our healthcare systems order about 2,000 ventilators a year. So per year, our healthcare systems order about 2,000 ventilators. There was a 3-day period last week that just one supplier had an order for 600 ventilators. Right now, there is probably, a demand for, tens of thousands of ventilators. And so, obviously, our focus really is how do we absolutely, increase that supply chain, get first of all, the known manufacturers up and producing at full capacity, and then get other entities that, have adjacent manufacturing capability. How do we actually get them producing products as well? So all those conversations have been happening for weeks. And so if you don't mind, Sarah, I'm gonna keep highlighting a couple of the other issues. So other, PPE, so things other than N95s, 80% of that product comes from Asia and India. And, when you have the virus that impacts, those countries, obviously manufacturing shuts down, which only exacerbates the issue. Fortunately, China, who manufactures a significant portion of that 80%, is back up and running as of March the 13th. So we are, getting product out of China. Unfortunately, Malaysia is, sort of in a scenario right now where they're sort of doing the shelter at home, which, is potentially could put some constraint on the supplies that they provide. Now, they do have, some outs on that policy to allow, employees to go to, work at some of their large factories that provide some, very critical products. But the point is, when this virus spreads across various communities, not only does it, affect us in the U.S., but it also affects us as, the organizations that we rely on from a global standpoint to provide product, and the virus hits them. It actually has a tremendously negative impact on the supply. And then one other example I'll use, and I'm sure you've heard a lot about this, but COVID test kits. I guess there's, the CDC had one primary provider of the swab that actually collected the sample. for the virus. And unfortunately, that swab was actually produced or is produced in northern Italy. And the significant issue that the Italians are facing as a result of this virus. Fortunately, that factory is still up and running. And fortunately, the U.S. government has sort of stepped in to use military aircraft to ferry product back and forth from northern Italy to the U.S. So I think they're on a schedule of 2 to 3 years, two to three times a week to bring that product back into the U.S. So that kind of gives you a backdrop of what the scenarios are that we're facing. Oh, by the way, one other large, obviously, item that, we're in short supply on is hand sanitizer. Fortunately, there's a lot of domestic, capability and capacity to create that. So, we've got, a lot of irons in the fire to get, production up and running domestically as quickly as possible. So I hope over the next few weeks we'll see we'll still have shortages, but we just won't have shortages to the acute nature that they are today. So
great,
Sarah,
thank you so much, Mike.
Huh?
Mike, that's a great overview. And so I just want to kind of follow a little bit more on this international perspective. Given the dependence that we have clearly shown to have on manufacturing from other countries that have been hit. Obviously, the outbreak started in China. You mentioned several others. What are the challenges going to be with getting manufacturing up and running in the U.S.? And do you think that going forward the supply chain is going to be more diversified? I mean, are you worried about further breaks in the supply chain given that this is a global pandemic? Can you just share some of your perspectives on that international supply chain?
Sure. So a couple of things. I'll give you some facts, and then we've sort of have, sort of these, 5 areas that we think we need to focus to sort of fix this issue long term, and to answer your question about, producing things more domestically. But let me give you one other perspective that is, as we're having conversations with, folks in the industry and just, what's out in the media. India actually just stopped exporting, this was last week, 13 active pharmaceutical ingredients and 13 finished goods. 2 of those products include erythromycin as well as vitamin supplements. And obviously those products are absolutely critical, when you have patients that are fighting a virus. And so, those kinds of activities that occur just put a heck of a lot of stress and strain, on the supply chain. So what Premier fundamentally believes, needs to happen going forward. One is obviously in the short term, our focus is to get as much product over here as possible, and working with manufacturers globally that, we have, some form of a relationship and have a level of comfort that they produce high quality products, to try to get as much of that product in as probably many of unnatural ways as possible to get it here. And we're in discussions with, it's unbelievable, the support that we have been, given from, huge players in the U.S. that are major employers, from commercial airlines to automotive companies to apparel manufacturers that, are offering up support and help to get product here and to manufacture products. So, if there is one silver lining in this thunderous cloud, it is this incredible American ingenuity and support for, the community at large, and so that is the silver lining. But there are 5 areas that we think we absolutely, need to focus on longer term. One is we need to increase transparency, to increase the confidence that these supply chains can maintain some level of resiliency. The issue we're dealing with, if you think about a commodity good or you think about a generic drug, definitionally, these products are going to have narrow supply chains because the public at large, the consumers, are expecting a commodity price to be priced like a commodity, and they're going to expect a generic drug to be priced like a generic. That means it was produced for $10 or $15 at some point in time, and now they expect it to be produced at 5 cents. When that happens, you have to create these unbelievably efficient and narrow supply chains that have no redundancy and they have no resiliency. And so I think that from an industry standpoint, we've got to do a better job of understanding where these products are being produced, the country of origin, and then in the case of pharmaceuticals, where the active pharmaceuticals are actually being manufactured, and also the excipients. The excipients are the other ingredients. So if you look at your label of your pharmaceutical, you'll see active pharmaceutical ingredient, and then you'll see the other ingredients. And for a lot of the products that we use in the healthcare systems, these are products like stabilizers. These are products that are infused in patients. So they're stabilizers. They help to. There's antimicrobial products. There are a number of products that are the other ingredients that are used in these finished goods, and we have no transparency as to where those products are being produced. And we're worried that a majority of these are produced in just a couple of countries, to include China. And we want to make sure that we bring total transparency, to all of those products. Two, we've got to diversify both globally and regionally where production is occurring. So I'll tell you, there are certain products that we know we need in the event of an epidemic. I fundamentally believe, a number of my healthcare systems fundamentally believe, that we've got to produce more of these products domestically and near shore. And so I think you're going to see a significant focus for probably about 22 SKUs of products to include, masks and visors and covers and those kinds of things. I think you're going to see a lot more focus being produced of those products being produced near shore and onshore. So that number two is really all about the diversity of the supply chain. Number three is basically leveraging the technology that Premier has been building out over the last couple of years with our healthcare systems to create this one point of understanding how orders are occurring across all of our healthcare systems. So, and we've got to be able to aggregate that data. So all of the orders that are occurring, because what that will allow us to do is to be hyper vigilant in terms of identifying where shortages are happening early. We know, just like most of us, we're sort of creatures of habits. We know when a shortage begins to occur when there's an aberration in ordering of a product that doesn't naturally happen. And so we've got to leverage our technology to understand the nuance of what's happening and why people are ordering differently. And for the most part, they're doing that because obviously there's a shortage or they're struggling getting access to a product. We also know that, we've got to start, and we've done this with very, very, very critical drugs in blood products and IVIG and albumin. But we know we've got to source products and then dynamically allocate those, meaning source for a bolus of the healthcare systems, create 5, 6, 7 global suppliers, and put that into one large pool, and then dynamically allocate that where appropriate to healthcare systems. And then, those that need extra, they can pull from that pool. Those that don't need their allocation, they can put those back in the pool. And then, number 5 is won't be a surprise. We need to make sure that, we financially invest in these long-term strategies. That, this is going to require some pretty significant infrastructure if we build this capability, or I should say not if, when we build this capability domestically. And we've got to, take a view of this as a very long-term investment. So, Sarah, I hope I answered your question.
You did, Mike. These are great points and good future lessons learned. And we've already gotten some questions coming in from the audience. And so, again, I want to remind everybody to send us your questions for Mike anytime using the questions pane on your attendee interface. So just we've had a couple of questions about this just-in-time supply, and I want to ask you, can you tell us to what degree hospitals are or have been maintaining stores of supplies just in case? Do we think that the just-in-time supply strategies have undermined providers' access to PPE? Tell us a little bit more about that and how that even works in the healthcare sector.
Okay, so this is like crazy complex because it's different by literally every SKU of every product, within a category like personal protective attire. So there's, imagine thousands of SKUs. But in general, our healthcare system will keep a couple of weeks of supply in their current, in their stores. If they have warehousing capabilities, or some SKUs that they'll keep, maybe 3 or 4 weeks of supplies of products. But it's dependent by the healthcare system. It depends on the services that they're providing to their communities, and that goes all into how they determine how much to hold. So the reason that this is so profound is there is not significant amount of inventory, either in the local healthcare system, in their distribution capability, or with the distributors that they work with. So you're talking max couple of weeks, and to 3 or 4 weeks. It's different in pharma. So we have a program called Provide GX, where we literally work with, for the most part, domestic, but we do have some international players, but domestic suppliers that provide high-quality generic drugs. And we got into this space because we wanted to create more suppliers in these areas. Because oftentimes when you have one supplier or two suppliers, it sort of exacerbates, as you would expect, the issue of a shortage. If somebody has an issue with quality and you only have two suppliers, then it goes to one supplier, then oftentimes you see stress put on that supplier. Plus, obviously, you'll see pretty significant price increases. So the focus of Provide GX really is to create more suppliers for generic drugs that are in short supply. In our program, we expect the suppliers that are part of that program to have 3 or 4 months of active pharmaceutical ingredients and other ingredients. So it's a little bit longer tail for those drugs than it is for the PPE. So you have a few months of supply in those areas. But as we have seen with Coloquin, right? I mean, who would have thought that a malaria medicine would have had anything, a potential positive indication? I'm not suggesting it has, but there seems to be a lot of press around Coloquin. Well, there is significant amount of supply of Coloquin that is actually done or is produced in England, and that went on sort of embargo, or that sort of they reduced the amount that they were exporting of that. But fortunately enough, we started to work with some of our domestic manufacturers to get that product up and running a few weeks back. But it's things like that these products are out there, and they're used for other, like Coloquin's used for malaria, and there's not a big demand of that, and so you have a very, very small capability to produce it. But when events like this occur, there's obviously just not enough capability to meet the needs of the demand. So I hope that answered your question. But the net of all of it is short. We have very, very limited product and inventory for personal protective apparel and some of those medical products, and then it's a little bit longer for pharmaceuticals.
Great, that's helpful. Okay, we have time is flying, and we have a few questions here about the federal response. So, question around, how does federal involvement affect the supply chain? Are FEMA and other federal groups competing for the same supplies as your customers that are trying to buy? How does your company handle that? There was another question around federal oversight, and I think to your point, number 4, about sort of dynamically distributing supplies as they're needed. Is there sort of a federal role in figuring out who needs what most? And then finally, if you want to kind of comment on the Defense Production Act and whether that would help or hamper your efforts to streamline, getting the supplies in the right hands, and as you mentioned earlier, getting some other domestic producers up and running, like some of the non-healthcare companies. So a lot of different questions mixed in there, but talk about the federal response and how that's going.
All right, Sarah, and you jump in and interrupt me if I go too long. So we created a couple of weeks ago, we created a coalition of all the GPOs, all of the distributors of medical products, and then manufacturers to include ventilator manufacturers and some mask manufacturers. It truly was sort of this unprecedented collaboration across all GPOs, all these distributors, and these manufacturers. As part of that coalition, we are working with FEMA and with HHS, and from the way that I sort of interpret the meetings over the last couple of weeks, it seems like FEMA is taking point on sort of the government's response to all this. They have their strategic stockpile, and they're thinking through the appropriate utilization of the strategic stockpile of these medical goods. They have created some models in terms of, to answer your question around, what they're doing. They've created models to show sort of, the progression of the disease, so where the surges are. We're providing data. We have all that data from our clinical tools. We have about 1,400 hospitals that subscribe to our clinical data that has all this discharge data and data that really shows what's happening from a healthcare or hospital utilization standpoint. And so we've been building out models. They've been building out models. We're sort of coalescing what are those right models. And the point of all that, and the reason that's so critical is it helps us with, sort of the, where supplies are needed and where they're going to be needed next, and how do we make sure that we're trying to stay, on top of it today where it sort of is happening in real time, and then try to stay, if possible, stay ahead of it, in other areas. So the net of all of it is, FEMA is in the middle of it. They built those stockpiles obviously for shorter term disasters, and so I think they're focused on how do we build out more capability. At this time, I think FEMA's been pretty clear. They want the private sector to sort of really drive this through this coalition and work through this issue. They are here to support us. They are here to provide logistical support, meaning, if we need to get products that historically have come in on ships to be flown over, they have been, in the middle of all this and doing a very, very effective job, supporting this coalition that was created. So I think that, the Defense Act. So just real quickly, I think what that has allowed is for a lot of innovation to occur very quickly. And so that act has a number of sort of arms to it, but one of them is to allow for, allows for entities to produce products very, very quickly and with, without having to go through significant FDA approval typically, which takes a long time in a very, very short period of time. So I think by enacting that, it allows us to get a heck of a lot more production up and running, as quickly as possible.
Hey, thanks, Mike. So just in the minute or two we have left, can you tell us just what do we need to be looking for in the next week? You mentioned a little bit about sort of the social distancing and kind of how that might affect the supply chain. When do you think it's realistic that emergency nurses, doctors, and other frontline providers are going to actually get the equipment that they need and not have to ration or reuse it? Like, what do you think is going to happen in the next week?
It's so hard to tell, Sarah. I will tell you, you just have to think about, there are different parts of our supply chain that normally never even had these products. We've been talking about the acute settings, but, these poor people in Seattle that, were in these non-acute settings, they didn't even have these, gowns. They don't have the access to the gowns and the N95s. And so, we have been like full on trying to ensure that, these entities that traditionally had not used these products, get access to these products. So I think you're going to just see a lot more of that kind of activity, and I think you're going to start to see unbelievable partnerships formed between organizations that don't historically provide product getting into the business of providing product, flipping it on, and so that it may not be imminent, but within a few weeks, you're going to start to see a pretty good inflow. Right now, and the president of this organization that runs our direct sourcing business, and he constantly reminds me. Right now, China has turned on production, and that is a huge relief. But stuff changes every minute, and so Sarah, I'm afraid that whatever I would prognosticate right now would change probably by the end of the day. But suffice it to say, there is an incredible focus on getting as much product as possible to, those frontline clinicians that are absolutely incredibly, fighting this disease on behalf of these patients.
Well, thank you. And speaking of minutes, unfortunately, we are out of them. We join you in thanking all of the frontline clinicians, both in the acute care settings as well as throughout the healthcare system, who are fighting so bravely to manage and cope with this pandemic. Thank you for all of your efforts and for joining us. And thank you to our audience for asking such great questions. We're sorry we didn't get to all of them, but please feel free to stay in touch with us at the Alliance. We will do our best to answer them or to get you the information that you need going forward. For those of you who want to take another listen, just as a reminder, we recorded this webinar and you can view the full event webinar and transcript at our website, along with all of the other webinars in this series. Stay tuned for more in the next week. And tomorrow we will have a legislative and regulatory roundup to walk through the bill that is currently under consideration. We want to thank Mike again. Thank you for joining us and taking time out of your incredibly busy 18 plus hour days for joining us on this webinar and sharing your perspectives. Thank you.
Sarah, thank you for having me.
Great. And thanks again to our audience. This concludes the webinar.